Okay, listen, I have to go. He finally came into the room. What? Listen, I have to go. Bye.
Hello, my name is Chris and I'm the physician assistant on duty today. Before we begin, I would like to ask you to please turn off your cell phone. There is a sign on our front door, one at the receptionist window and another one in this room, that state that cell phones should be turned off while in this clinic due to patient confidentiality laws. Thank you.
But I just got this phone today. It is a new iPhone, and I do not know how to shut it off. Besides, what if I am needed in an emergency?
An emergency? What do you do for a living?
I don't do anything for a living. I can't because of my medical conditions. I am trying to get on disability due to my problems. 2 of my friends are at the emergency department right now.
I'm sorry to hear that. Were they in an accident?
If I were to tell you, wouldn't that be a violation of patient confidentiality?
Good point.
Besides, if you didn't keep me waiting for such a long time, I wouldn't have to talk on my phone. This wait is ridiculous. I have been here for over an hour and I am in desperate need of assistance.
I apologize about the wait. We are a busy clinic, and I'm the only provider on today. I try to move as quickly as I can, but some complaints require extra time be spent with other patients. How can I help you today?
I need a refill on my medications.
Okay, what are the medications that you need refilled?
Valium, OxyContin, Ritalin, Ambien and Neurontin.
You are out of all of these medications?
Yes.
And you obviously have a primary care provider who has prescribed these for you.
I recently moved up here 5 months ago, and I have not had any time to establish with a primary care as of yet.
Please turn that off.
I can't. Hang on. Hello? Not yet. Did Frank get his yet? How about Becky? I'll call you back when I get him. Yes, we are still on for tonight's A8 dish. I have to go. The PA is giving me dirty looks. I don't know what his problem is. Bye.
Once again, I have to ask nicely to please turn the phone off, or at the very least please don't answer it. Now, where were we? Oh yes, you don't have a primary care provider and you are out of all of your medications.
That is correct. I need all my medications and I need refills until I can get in to see someone else.
What are the medical conditions that you have been diagnosed with that require you to be on these medications?
Oh, where to begin? Let's see, I have ADHD, severe anxiety, chronic back pain, insomnia, PTSD and mood affective disorder.
You are only 23 years old. How long have you had these problems for?
They all started about 5 years ago, when I got into a traffic accident. I volunteered with Big Brothers Big Sisters, and I was taking my little sister to the hospital for her chemotherapy treatments, when we were hit by a doctor in a Mercedes-Benz.
Oh my God. Were you hospitalized?
No, the accident occurred in the parking lot and there wasn't any real damage to the car. I didn't have to go to the hospital however ever, since my problems have been getting worse and worse. I have never been able to work since that day and my life is a living hell. Hold on, I've got to answer this.
No, you don't.
Hello? No, not yet. He asks a lot of questions. Yes, I told Barry 8 tonight. He is going to bring the drinks. Listen, I have to go. I'll call you in a little bit.
Are you going to a party tonight?
My church group has a Bible study every Thursday night.
But today is Monday.
Whatever. Listen, are you going to help me or not?
Okay, I think I need to be upfront in telling you that we do not manage chronic complaints at this clinic. I do have what I believe are legitimate concerns regarding the medications that you are on. Am I correct in understanding that at one point in time a provider decided that the best way to treat your conditions was with a combination of medications that all have abuse and misuse potential, along with the risks that these medications taken together can have an additive effect and very easily kill you?
Well, we tried other medications, but I respond best to these. I was recently evaluated by a chiropractor, and he put me on medical marijuana to see if this helps. I do feel a little better, but still need my other meds. Besides, I can't take many medications due to my drug allergies.
All right, I'm sort of required to ask this, although I'm fairly confident as to what the answers might be. Albeit, what are your drug allergies?
I am allergic to all non-steroidal anti-inflammatories including Toradol. I cannot take Ultram. I am also allergic to biofeedback and physiotherapy. Listen. I don't have time to sit here all day. I am a busy person who has other more important things to do. Will you or won't you give me my medications?
We are almost done here. I have just a few more questions. Do you smoke?
I have a legal prescription for medical marijuana.
No, you already told me that. I meant tobacco. You know cigarettes?
Yes,
How long? How many years?
forever.
Can you give me a number?
For as long as I can remember.
Okay, you are 23 years old. How far back do your memories go? I mean, I can remember things from when I was 5. Were you smoking at 5 years old?
Listen, I don't know. I am in too much pain to think right now. I need something for the pain. And my anxiety is starting to flare up. These questions are giving me a panic attack.
Well, as I mentioned to you before, we do not manage chronic conditions. Do you have any acute complaints? What is bothering you right now?
I am in severe pain.
Okay, on a scale of 0 to 10, with 0 being no pain and 10 being the most severe pain you could imagine, where would you rate your pain?
11.
I don't think you understand. Let me put it to you this way. I own a .45 caliber handgun. If I were to place it point blank over your right great toe and blow it clean off, that would be a 10 out of 10. Knowing that, where would you rate your pain?
12.
Let's just move on.
11? Am I going to get anything? I need IV medication, and now, before I get any worse. Are you going to give me my medications, or what?
Or what?
What?
Exactly.
I want to see someone else.
Me too.
I don't think I care for your attitude.
I agree, I don't care for my attitude as well. I would never accuse a patient of wasting my time because I get paid to hear your story regardless. You are, however, wasting the time of all of the other patients in this clinic. We are not a fast food drive-through where you place an order and expect to get what you ask for. And there is no way that anyone with an IQ over 100 would ever supersize this for you and give you any refills. Do you happen to know what a MAPS report is?
Yes, I mean no, I'm not sure. What is it?
I think you know. It is a report that details any controlled substances that you have had prescribed and filled over a set period of time. For instance, when you checked in, there was a Boy Scout standing behind you waving a 10-foot by 10-foot giant red flag. This was our first tip-off that something might be up, so we requested a MAPS report on you. I will be honest and state that it is not the worst report I have seen, but 10 pages over the last year is pretty damn impressive. In short, you have been prescribed enough controlled medications over the last year to take down and kill a fully grown African elephant. Really, the miracle lies in the fact that you are still breathing and talking to me today.
So, you are not going to do anything for my pain?
Listen, I'm here until 9 tonight. Your Bible study group meets at 8. I think I can outlast you. In short, I don't believe you will be getting the supplies you need.
But I am in severe pain.
So am I, but the nice thing is, my pain will disappear shortly after you leave.
I'm leaving and I am never coming back. I am going to call my disability lawyer and tell him to sue you for not treating my medical problems. I will tell everyone I know not to come here.
Well, as you are leaving, would you mind helping me unfold and hang up the mission accomplished banner on the outside of the clinic? If everyone you know is remotely like you, I'm certain that I will make Employee of the Month. I cannot thank you enough for volunteering to help clean up our patient population. Thanks again and have a nice day.